wristband?
Mm-hmm. That's enough.
Okay. So I guess I'm jumping into the bed after I'm the patient. Is this, this is recording now?
Yeah, it is. Okay. It'll be alright. We can exit things across and go. Alright. So, my student that I am precepting.
Yeah, I'm
Yes.
a student nurse.
Always. We are looking at Ronald Jarvis, and he is a 67-year-old male who is 5'11" and has come in for a partial thickness loss on his dermis, presenting a shallow open ulcer or intact fluid-filled blister on his lateral aspect of his right heel. Do you know what that means?
Yes.
Yes. It means that right up in here he's got a messed up foot.
Okay.
Yes.
That's a medical term.
Medical terms. That's all we use here in the nursing field. And so we're going to go ahead and go in there. We're going to just check on that, and we're going to give him his insulin because his blood glucose is high.
Okay. Sounds good.
I know you're a good student, and good students always have questions.
I've got a couple questions for you.
You got a couple. Oh, I don't know if I can answer that many.
Let me see what my questions
Are these your questions?
Those are my questions, yeah.
Oh, boy.
Why specifically is this client receiving the medication?
Well, your blood glucose right now is probably below 120, and you probably ate about 4 hours ago. That would have been your supper. His glucose is, well, no. Your blood glucose is a little higher if you ate, but still.
Yeah.
His blood glucose is a whole lot higher than yours is right now. It's at 242 milligrams per deciliter. That's not good.
Okay.
So we want to get that down.
Alright. What action does the medication have on the body?
Well, since he's a diabetic type 1, his pancreas does not create insulin. And so therefore, this is the insulin that his body needs to get his sugar from his blood into everywhere that needs it. It's like a key. It's going to open the door for the glucose to go in.
Sounds good.
It is good.
When should you question administering this medication?
Probably to someone who's not diabetic or who has a blood glucose level of 60 or anything in that area, especially if it's not in the medication administration record.
Okay.
Yeah.
Does the medication have a therapeutic serum level?
No, not therapeutic serum level, but you don't want it to go, their blood glucose to go below 60, so you monitor that. And you can, I want to get into your next question. I'm sure you have things I don't want to.
My next one?
Yes.
Which vital signs must be monitored?
As far as vital signs and things like that, like I said, blood glucose, you want it to be somewhere between 70 and 120, preferably. 60 is low, but it's not the end of the world if they get down there. You're going to want to look for any kind of lightheadedness or hypotension. Same thing with when you're giving the insulin, you want to watch out for those things, and that's pretty much it.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Which physiological? We're going to be watching out for hypoglycemia, and with insulin, it's probably going to be something that is rapid and pops right away. So you're going to be looking for, like I said, lightheadedness or jittery, shaky, cold, and clammy, and just overall not feeling well. Yes, they need candy. You're very, very astute. Next question.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, in the hospital setting, we want them to report to us if they start feeling ill. They should know he is, being a 67-year-old type 1 diabetic, he knows what hypoglycemia does to him. He's going to be feeling shaky and clammy and being lethargic, and we want him to tell us, press that call button so that we can come in and give him 8 ounces of milk or 4 ounces of orange juice or 2 ounces of grapefruit juice to get his blood sugar back up. And if he's unconscious, we're going to give him some other stuff.
That sounds great.
It sure does.
Okay. What interventions must be taught for taking the medication safely at home?
Well, he should know to keep his needles upright because that will help keep them from hurting him. And when he takes them to use them, he's gonna want to twist. Here we go. We have a beautiful needle right here. He's gonna want to go ahead and twist this around just to get things moving.
Oh.
Yes, it's weird. I learned that in an ATI book once.
Oh.
Yes.
Okay.
Yeah. And he's going to want to make sure that any unopened vials can be stored in his refrigerator for up to 3 months and then throw them away. Anything that is in use can be used for up to a month and then thrown away, and should be kept in an area away from sunlight and away from heat, so it should be in room temperature. So if he has a closet that's away from his water heater, that's perfect.
Okay.
And to make sure to dispose of anything once it gets past its expiration date. Aside from all that, don't mix glargine or detamir with anything, and yeah, that's pretty much what he needs to know. Oh, and when he's giving it to himself, make sure that it's in the same area so that the insulin is predictable, and to change spots, rotate within about 1 inch of each other, make 1 inch grid across your stomach, and stay at 1 inch at least away from your belly button.
Okay.
Yes, that's how he stays safe at home.
What are the side effects and potential adverse reactions?
If you do it in the same spot every single day, you just draw a tattoo with a bullseye and you just get yourself there every single time, you'll probably have lipodystrophy, which is not good. It's going to make your stomach right there get really hard, and it's going to hurt to put that insulin in there, which is why you move around. And then, and hypoglycemia, like we talked about. And I don't know if you said anything past that. What are the side effects and potential? Oh, okay. So I'm just giving you random, just general information. So hypoglycemia and lipodystrophy are the general problems that will be caused here.
Okay.
Let's see here. Yeah, pretty much.
All right. How will you know the medication is effective?
Well, he won't have signs and symptoms of hypo or hyperglycemia, and his blood glucose levels will show that he is somewhere in a reasonable range, right around 120 or less, if we can get him down there possibly.
Okay.
That would be preferable.
All right. Let's go get the patient now.
Go away. Enter the client's room and administer the medication safely. All right. So I am at my Pyxis.
Wait, I forgot my name.
It's okay. Your name is...
Oh, it's on my band. Forget
Yes! You know. All right. I'm going to check the magical mar. And the computer is so slow. It says to give him insulin glargine right now, 2200. And we can give... Ooh, actually, we can't give the glargine yet. So I will actually only be giving him his insulin, his regular insulin that is... Yep, just regular insulin. No mixed with anything. And I have no idea what he's doing in there, but he is making himself comfortable. So it is 21:38, too early to give his glargine insulin, which is due at 2200. So we'll just give him his insulin that is at 2100. I'm going to reach into this anti-diabetic drawer, find the one that just says insulin. Regular insulin, not combined with anything. Beautiful. And now that I've found that, I've checked Jarvis Ronald. That's who the person is for. He's 67 years old. He's getting regular insulin, Novolin, Humulin R, Reliant, Novolin R. And that's what this says all over it. So now that I'm at his room away from my Pyxis, I check again. This is Ronald Jarvis's room, room 893. And he is getting insulin regular, recombinant human regular insulin, Humulin R, Novolin R, Reliant, and Novolin R. And he is getting insulin, regular, recombinant, blah, 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 everything that I just said. And since I have this handy vial with me, I'm going to check. And since his blood glucose is 242, the sliding scale says to give him 16 units of insulin, regular subcutaneously. So I have this nifty little insulin syringe that is going to be used to draw 16 units. So beautiful. Is it okay to come in and give your insulin now?
Oh, sure.
Awesome. I'm going to open this. And since we can't close it while the cameras are rolling, I'm just going to say that I closed it. And we're going to leave this here because this is bulky. Maybe I can move it. I don't know.
Move the camera up here.
I think we'll be okay. We'll just say that the. There we go. We'll get this.
They can even see you giving.
I just. Oh, they can't even see me. Oh, I'll just keep this out here. Well, it'll be all right. They know this already.
Table up
What?
here.
Move this closer if you want.
Okay, yeah, we'll move things. Look at that sick little Ronald right there. Oh, he's feeling horrible. It's all hyperglycemic and stuff.
Yeah, because you're gonna have to scan. Oh, I think for this tape.
Moving all this into here. Let's make sure this is plugged in. Get it. Right out that side. And since the sink is way over here, I go ahead and wash my hands. Put some soap, wash my hands. Leave it running. Get the paper towel and dry my hands off, throw it away. Get another one, turn the water off. My hands are clean and beautiful, and I glove up if I had real gloves. I thought I had. Oh, they're over there.
They're holding the phone up.
Just put on gloves. These are gloves. They're skin color. Alright. I am here to give you your insulin. How are you feeling today?
Hypoglycemic.
You're feeling hypoglycemic.
Hyper.
Yes.
Hyper.
You're feeling hyperglycemic.
Feeling-
He said that of his own will.
Yeah, I don't know what's going on.
Oh man. He's that hyperglycemic. He's got 242 milligrams per deciliter running through his blood. Alright. So we're going to go ahead and just check your feet real quick. You mind?
Sure.
Sure. Alright. Your feet are healing quite well. I can see those ulcers are going away. You'll be out of here soon enough.
Oh, good.
Oh, yes,
I'm
quite
ready to go
wonderful.
home.
I'm sure you are. Alright. And is there a pillow out there? If there's not, I'll just give it to him for real.
Oh wait, I have one. I have one.
Oh, he has a pillow!
Yeah, I have one. That's my stomach.
It is his stomach. Alright. So, can you give me your name and your age?
Yes, Ronald Jarvis, and I'm 67.
And that matches exactly with the MAR and the medication and everything that I'm supposed to give him. This is the right person. It's the right time because it's 21:42 and it's due sometime within the 2100 hour. It's the right route because it's subcutaneous and I got this subcutaneous shot for this regular insulin. And right time, right place, right drug, right route, right dose, and everything is wonderful in the neighborhood. So, sliding scale says 242. I'm going to go ahead, get this insulin here, and just swirl it around in my hands. Put it down. I'm going to pop this open. Take this thing off. And pull down to 16. That's 15, that's 16. Going to go ahead and wipe this with an alcohol wipe. Well, circular motion. Gonna go ahead and stab it. Insert 16 mLs of air. And withdraw 16 mLs of liquid insulin. Yank it out. It's gonna hurt.
It's
No,
gonna hurt.
It's not. It's
It
not.
doesn't usually hurt too bad.
It shouldn't hurt at all. We're gonna give it a nice 90-degree angle because he's a big guy. And insert that just like that. And pull away quickly. And we have this nice little safety feature. Pop! That shot's not gonna hurt anybody ever again.
Great.
Oh yes.
Glad that's over.
Oh yes. We're gonna be back in here to check on you in 15 minutes, 30 minutes, 1 hour, 2.5 hours, and then we're gonna be back again at 3 and 6, and we're gonna be checking on you all night long. You won't get any sleep, but it'll be all right. You'll wake up in the morning with your heel, hopefully a little bit better.
That sounds horrible.
Welcome to the hospital. I need to go ahead, and of course, in real life, I just realized I did not scan his thing, and I gotta actually click on the drug first. There we go. Got a little carried away in silliness. That won't happen in real life. And scan. That's his real person, Jarvis Ronald.
That's me.
The 67-year-old. We're just giving your age to everyone. That's the drug. We've done everything right. And today's Tuesday. Here are my initials. And I'll say he loved the insulin. I spelled the wrong, but it's okay. Hold on. Can I scroll this down so I can actually hit OK? There we go. Save. Please, administer time. 21:46. Perfect. Oh my god. Save. By the and we can't give his login until 2200. So that's it for now. We will be back in about a half an hour to give you another shot of insulin glargine, which will last you throughout the night.
That sounds great.
Yep, it will be fantastic and glorious. And so now I need to come back into here, and I will leave the room after I have told him. Is there anything else I can do before I leave to make you comfortable?
I'm okay.
All right. I'm going to go ahead and push my stuff outside, throw my gloves away, open up the door that was closed. This is a private room, giving him all kinds of privacy. And you want your door to be open or closed?
Closed.
Closed. We shut it on him. We don't need to see his face. And my phone fell again. It'll be alright. No, it just fell. Like 2 inches. It's alright. Alright, so that's all closed in there. And I think my nursing student probably has more questions. They're inquisitive creatures.
Yeah. I sure look a lot like that patient.
I know, right? Like you could have been twins. You're so old.
I'm aging well, I like to think.
Alright.
Okay. If there were any pertinent pieces of information you reviewed before administering the client the medication, what were they?
I checked to make sure that he was who he really was and that his medication and everything in his MAR checked out alright. I checked his blood glucose level, which was just recently checked at about 2100, and it was 242, which on his sliding scale, as per described by the doctor, I was to give 16 units of insulin. And so I checked to make sure I had the right drug, right route, right time, right place, right person, right dose, and all of those magical things. And
You had them all.
I had them all. Everything was perfect. Just a little diabetic boy.
All right.
Yes.
Did this information affect your decision to administer the medication? Yes? If yes, explain how.
Well, it made it so that I decided to give it because it was the right person. And he needed it so that his blood sugar could go down so that he could live and his foot could heal better.
Okay. Did this information affect how you administered the medication?
Not exactly. It said give it subcutaneously, and everything pointed to give it as ordered.
Okay. I think that's all the questions I have for you.
Oh, so awesome. I was about tired of them. Alright, so step 4, we gotta stop the video.